Namaste, everybody. We are here today with Dr. Dixit, Anil Kumar Dixit from Prakriti Ayurveda Pratishtana in Mysuru. Dr. Dixit, welcome and namaste.
Thank you, madam. Namaste.
Yeah, Dr. Dixit was here, as you all remember, with Shri Rajiv Malhotra. And we have a lot of questions for Dr. Dixit today. And so without further ado, Dr. Dixit, the first question is from Sujata in Chennai and would like to know what are the general home remedies which can be taken for elders and kids apart from Amla and Amrutavalli for this COVID-19 crisis. And she also would like to know, do you have any mantra or japa that one can do during this pandemic?
We have two components here, ma'am. Number one, Sujata ji, I would like to tell you, for COVID, we have our Government of India, Department of Ayush, has come out with some simple home remedies encouraged by the Ayush Department, wherein it has suggested haridra or turmeric, ginger, honey, that combination. And probably, like you, since you have asked regarding the dosage, I would like to tell for all elderly people, say haridra or turmeric powder to be taken around 1/4 to half a teaspoon. And then shunthi, ginger juice can be extracted, and 1 teaspoon of the ginger juice with a teaspoon of honey can be a good combination. This helps to improve the immune systems, and also it reduces the mucus secretions that are there in the upper respiratory area, like the throat, the nose, and all this. It reduces that. So you can improve on that. And as we all know, Tulsi is a very good home remedy. Tulsi or the holy basil leaves to be crushed, around 2 teaspoons of holy basil leaf juice can be given with honey, maybe a teaspoon of honey. It can be given frequently depending on the intensity of the or the frequency of the condition, like the irritations. You can be giving 3 to 4 times a day, like that.
Okay, so Dr. Dixit, what about people who are getting a mild cough on the early stages of an infection?
Correct. For the mild cough, as I told you now, tulsi or the holy basil leaf juice with honey can be very good. You can chew on clove long, keep it in the mouth and keep dissolving in the mouth, or probably chewing in the mouth, suck the juice in. That can help to relieve the sore throat and irritations there. And we have pepper. We can make the pepper kashayam or the decoction infusion. The pepper tea with a little turmeric and a little jaggery can help a lot too in such conditions. And in our homes here in India, we do have vacha, Acorus calamus. We call it also baje in the local language. Vacha or the Acorus calamus root can be, rubbed against the stone, and that can be taken in very small quantities. And we have the cumin tea can be made, coriander tea can be made, and mint has a lot of role to play here. A mint tea can be had, and probably mint fumes can be taken as inhalation. That also helps to relieve the congestion when we inhale the mint and clove. So even clove can be used. Eucalyptus oil is very commonly used here. Say 1 drop of eucalyptus oil in hot water, you can take the fume, and probably you can put eucalyptus oil in on your handkerchief and keep sniffing it, and that can also help you out too. These are simple remedies that can be tried.
Now, do you recommend everyday inhalation?
Only if the conditions is prevailing. If they are getting better, probably we can bring it down. I would like to stress upon the need of putting 1 or 2 drops of ghee or sesame oil or coconut oil into the nostrils and do a gentle massage onto the nostrils, so that it forms a clean layer on the inside of the mucosa. nasal mucosa, and we call it Pratibarshanasya in Ayurveda. That helps a lot to improve the immune systems against all these maybe allergies or infections, both.
Okay. Okay, great. Thanks for those wonderful tips. There's a question from
Welcome.
Vijaya Raghavan from Bangalore, and he says, in the past, what were the trade diseases or foreign-grown imported diseases reported in India, and how did the traditional medical practitioner help the general population to overcome these diseases that were brought in by the traders that went out?
Rightly asked, ma'am. Every disease that is prevailing today has not been mentioned in the classics or the textbooks of Ayurveda. That is the one simple truth. Well, Ayurveda textbooks have been redacted periodically, and there have been newer editions having all the additions of newer materials coming in from all directions. Coming back to the question of Mr. Vijay Raghavanji, I would like to say way back in 15th century, 16th century, when people started having trade with India, there had been newer diseases peeping along with them. And for example, we have the later texts of 17th, 16th, 17th century. We have this from Yoga Ratnakara, a textbook that we have. They mention the disease like Firanga and Upadamsha, which can be correlated to syphilis and gonorrhea. And they were not
Okay.
here in the ancient India or the earlier India. So we have those diseases coming in, and those diseases are being understood, the pathology and the pathogenesis, the cause, and the whole, including the prognosis, and the treatment modalities have been framed. So based on the same Tridosha theory, based on the same principles, we have the whole picture of treatment being framed. So that's how we have newer diseases and a framework of treatment. We call it Chikitsa Sutra.
Okay.
That is also being characterized. Yes,
And have we successfully treated syphilis and gonorrhea and things like that in Ayurveda?
correct. I should definitely say so.
Okay.
Along with the Ayurveda herbs being prevalent then, we also had the other herbs from the Arab coming to India through Unani. Even that science, those materials are also incorporated in Ayurveda text. We understood the details of those medicines, and then we tried to accept it the Ayurveda way and made formulations with them. Like we have a drug like Chopachini, which is not of the Indian origin, came from there, and then we have been using that as an Ayurveda medicine here.
Satvik from Rajasthan has a question. He says there are reports from China that they have used Chinese traditional medicines to cure COVID. What are your thoughts on that? And number two, has Ayurveda been used on patients to treat COVID in the past few weeks that you have seen?
This question has been running around a lot, but we still do not have any documentation on that still, and they have not still disclosed that they have been doing. But now, probably they would have tried traditional Chinese medicine along with the allopathic medicines too in the China. May it be. Now, to tell you, we in India, where we have the origin of Ayurveda, we have a lot of Ayurveda informations, the medicines and therapeutic procedures to definitely deal with the condition. We are ready. We are ready as a team of soldiers to fight against COVID with the armaments of Ayurveda medicines. We have everything ready, and if the permission is given, we're going to address that. And for your information, from Kerala, there is a list of medicines the government has accepted, and they are trying it in various departments, like health personnel who are working against COVID. They are being supplied with Ayurveda medicine to improve the immune systems there, like that.
Okay.
And Goa has accepted to take Ayurveda as a frontline medication along with allopathy, going synergetically to
Okay.
fight COVID. Like that, each government now is taking up this, and then probably as a whole, India would be ready with this concept of joining Ayurveda in the front line with the present available allopathic medicines to fight COVID.
And are they taking, like doing research also at the same time, trying to find out and publish those results and document the cases?
Yes, madam. Now we have some documents already with us, with the Ayurveda doctors. I mean, the research labs or research institutes in Ayurveda, and claiming the positivity of antiviral properties of various herbs, antiviral properties of various medications, and the therapeutic procedures that can be employed in conditions like COVID. And we have,
Okay.
and because we have already other flu, influenza, which was there with us, and we have been combating that. And we had H1N1, which was very prevalent here, and we have very well, won over H1N1. And as Ayurveda doctors, we had all tried with Ayurveda medicines, and we have the documentation supporting that. And based on this, now COVID is a pandemic condition where we are not directly into the COVID still. Probably now the government takes up, loosens the policy a little to involve all of us, and probably collectively, and then we would have the statistics and the data available to publish, and then probably, yes, that should happen.
Okay. Arul from Tamil Nadu has a question. How does a doctor protect himself from the COVID-19 infection if he were to treat a COVID patient in the Ayurvedic system?
It is simple that one has to go with the international protocols of how you have to go. You need to be educated very well regarding what you are protecting from and how you are doing it, the procedures, and you have to undergo with the protocol, and that's it.
So you would use the standard PPE that the Western, protective gear.
Yes, the same PPE, correct, madam. Yes, madam. Yes. So all these gadgets are utilized, and yes, madam.
Okay. How far is research happening in Ayurveda? Are there new drugs coming out every year, like in the Western system?
We have research institutes, postgraduate institution from Kanyakumari to Kashmir. We have Ayurveda hospitals, Ayurveda research institutes, Ayurveda postgraduate departments working in the field of research, and a lot of activities are happening. That's number one. We need to understand what exactly research means. It is not finding a new molecule. It is trying to understand the molecules that are present in the materials that we already have. We need not have to find a new herb and go into the forest, find a new herb and call it Sanjeevani. You need not have to do that. We have a lot of materials around us. If we start researching them in the same textbook, researching the same textbooks, probably we may come out with many, many new things, ma'am. So that is what is required. I think I would like to stress upon this date, and this is what Ayurveda research is going on. On the basis, it is not just that antiviral property of turmeric. It is not just that. It is something like probably you're adding turmeric into modern pharmacopoeia with that. Ayurveda research is based on the Ayurveda principles, like how it can reduce vata, or how it promotes the agni, or how it reduces kapha. These are the important things. And with newer herbs probably coming from the West, like as I gave you an example of Chopuchini, we have tried to understand the Ayurveda way of the material which is not available here. So that's how we understand. There have been newer drugs, like newer combinations coming up, and the old, whatever has been already available, like Chavanprash, for example. What are the newer aspects of Chavanprash? It's the same Chavanprash, but newer, potentialities, activities. Say, Chavanprash cannot be given to a diabetic person if it is so, because it has a lot of sugars in it. Then probably we need to have a Chavanprash which doesn't contain sugar too. Or probably we need to go with a different compound which can help the way the Chavanprash is doing. So this way we are trying to work on that, and this research is progressing very, very well.
Okay. Now you can't. You see, now you take an active ingredient in the Western system and make a pill out of it. But I thought Ayurveda was more about taking the entire root, which contains
It's more
for
holistic.
example. Yeah, so that so when you take the root in, some of the toxins that come along can also be flushed out with the system, as opposed to just taking only
Correct.
an active ingredient of a particular thing. So is the research more focused on bringing outside things into Ayurveda and following an Ayurvedic system, or is it more focused on taking active ingredients from Ayurveda and then inserting it into into a Western
Correct.
pill?
Correct, madam. I just would like to elaborate on this with an example. Now, in the Western medical science, like the modern pharmacopoeia, now whatever it is there, earlier, say if we go back 200 years back, there was nothing like a medicine for hypertension. We used to understand the blood pressure. There was an invention of sphygmomanometer, and we used to understand the blood pressure, which was on the higher side. And there was no specific medicine to reduce the hypertension. So at that time, in India, we were attending similar conditions where hypertension, though we didn't have a sphygmomanometer then, we used to attend the conditions with Ayurveda herbs. I would give you the best example of Sarpagandha. It is Ralphia serpentina. And this was one among the herbs that were commonly employed with conditions like hypertension and alike. So, when a Western eye saw this, okay, then he thought, well, this herb root probably has to be, I mean, that is the glasses that he has, the colored glasses through which he sees. Probably one ingredient, let me just take it out from serpentina root, and they call it reserpine. Okay, this reserpine is the molecule that they alkaloid that take it out from Ralphia serpentina root, and then that was being given as a target medication. Naturally, that reduced the blood pressure. And there were a lot of side effects with reserpine. So later, though it was the first medicine for hypertension or the high blood pressure, later reserpine is not being used because of the side effects. And for your information, ma'am, we have been using Sarpagandha roots even today, and with very, very less side effects or no side effects. And they are being processed with different other herbs. And that's the beauty of it. Probably
Okay.
that's where we stand a little different.
Right, the holistic approach.
Correct. The holistic approach is what is more required.
The next question is there a dosha classification for nations too, as there are for humans? Is a question from Mr. Kishaloy Chakraborty.
Yes, Mr. Chakraborty has asked a relevant question, madam. I would like to say in Ayurvedatics, Desha has been divided into two. One is Bhumi Desha, and the second one is Atura Desha, the body of an individual. Say, this Bhumi Desha, I mean the land, is divided into three, or this Desha, or the geographical Desha, is divided into three. Number one is Jangala Desha, number two is Anupadesha, and number three is Sadharana Desha. Here, Jangala Desha, where it is little on the dry side, is Vata Bhuishta, like it is Vata increasing. And most of the people there are Vata predominant people. I mean, there can be variations. There are individual variations. But in general, those people who live in the dry area, they are more Vata. Compared to those people who live in marshy area, wet and humid and, rich vegetation, that is the Anupadesha. And those people are more Kapha people. And Sadharana, there can be a mixture of both. This is how, of both, and there can be Pitta also associated. Like there are people being distributed. In Sadharana, it is in between. Okay, so keeping this in mind, we need to also understand from which place the person is. Probably, especially in managing the diseases like epidemic or pandemic conditions. If we understand the Desha, probably we would have a gross, vague clue which type of people they are. And based on that, we may select either Vata calming diet or Pitta calming diet, though there are specific medicines. With diet, we can just try to reorganize and probably help.
Instead of going custom, we can at least, for a pandemic, we can address an entire group.
This type of a classification do help.
Okay, but how would that change? Say I come from sort of a marshy place, but now I'm living in a dry place. Now, would I inherit some of these kapha qualities, or will I get a new dosha?
The person who has inherited certain qualities from his ancestors, it is what we call it as sahaja. There is a dosha due to the sahaja. It's like, sahaja, it is born, it's inborn. Sahaja means inborn, so it is sahaja variety. But there are dosha changes, like I'm brought up in a different condition, in a different desha, then probably that desha would have an influence. I'm born from a vata strong dosha, and I'm brought up in a kapha strong dosha. Then there is a little variation within. There is one thing what we call it as adaptability. You need to have certain regime, like the dinacharya, which try to overcome this difference. Then probably you are trying to make some balance there.
Okay, okay. Ramanathan Lakshmanan has a question, and he says, "Can we better our immune system with pranayama?"
Pranayama definitely improves the immune system. I would like to quote this way. Pranayama, what exactly it does, it reduces stress at the first instance. And when stress is reduced, then naturally the toxins that are produced within are also reducing. Naturally, with that, you're improving your immune systems. That's number one. Number two, pranayama. Now, with respect to the respiratory affections that we come across now, pranayama help a lot to improve the respiratory immune system. Like the dirgha shwasa, like for example, if we start taking very deep inhalation and deep exhalation, you are totally clearing the morbidity within. I would like to tell this way. It is something like ventilation. We do Kapalabhati, for example. Kapalabhati is a forced exhalation with with a passive inhalation. If we do Kapalabhati, probably you are bringing out the toxins very easily. Then we have a pranayama like Bhastrika. Bhastrika increases the ventilation, and sometimes you may even go blackout with hyperventilation condition with Bhastrika. Bhastrika, when you do, probably you are increasing the lung capacity that way. So when you have a regime like Nadi Shodhana, followed by Anuloma Viloma, followed by Kapalabhati.
And what does Nadi Shodhana, Nadi Shodhana do for you in terms of pranayama?
Correct. Nadi Shodhana is a preparation for pranayama. And there are Ashtakumbhaka, 8 different pranayamas mentioned in the Yoga Shastra. But among them, Nadi Shodhana is an exercise to bring you to the pranayama level. Nadi Shodhana is nothing but taking the breath from one nostril and leaving the breath through the other nostril, from right to left and left to right. We always start from the left and we close the right nostril to breathe in from the left nostril, and then we leave the breath through the right nostril, and we alternate it. The cycle continues. When we do it, there is a rhythm of breathing, and you are doing the deep inhalation. It is not just superficial. It is not that. It is that deep that you go and then you breathe out totally. It is the total lung, respiration followed by abdominal respiration. It is not that your lungs are only working. When you inhale, you bloat your abdomen, and when you exhale, you draw your abdomen in, and that's how you breathe, and that makes the whole system work supportingly. When you have practiced Nadi Shodhana, when you have practiced Kapalabhati, and this helps to clear the secretions when there is an affection. It is not when you have a problem, breathe and do it. It is that you make a habit of doing all this, and your lung capacity is so strong that you just one cough can eliminate all the materials out. One cough can bring the mucus out so that you feel relieved. The lung capacity improves, and when you have been practicing this for some time, you have the practice, and that makes you help to cough out the mucus that are there, which is accumulated. probably a person who is not doing the pranayama may find it difficult to expel it out. That is the advantage.
Okay, I have a next question from Shreyas Raghavan. Yeah, he says, "Can I get some clarity on Ayurveda's view on exercising? Because I have read online that Ayurveda discourages fast and vigorous exercises leading to sweating. But on the contrary, I feel very rejuvenated and mentally fresh after jogging or running, while walking alone doesn't lift my dullness." It's a very good question.
Exercises have been well being described in the Ayurveda texts, and it is of very important activity during the daily regime, and everyone should get into exercising. How much of an exercising is the one that is understandable, like that is being decided by the body type that he has. A Vata person should not be doing a big lot of exercising, but a Kapha person should do a good lot of exercises. A Pitta person should be doing in between. This is what based on the body type. A Vata person would love to be very active most of the times. A Kapha person would not love to exercise much. Also, this is the attitude with a Vata person, with the Kapha person. So, likewise, we need to personalize the exercises. And one more thing, uh, exercising a lot is not a requirement. I would like to make it more clear. Why an exercise? The Ayurveda texts say, Laghavam karma samarthyam deepto agnihi medasah kshayah vibhakta ghana gatratvam vyayamad upajayate. It means it makes the body lighter. This is what everyone should find. Okay? Laghavam karma samarthyam means the efficiency. Like every person would be efficient to do whatever he is going to do. And then Deepto Agnihi means the digestion, the metabolism improves. It increases. That we know. Deepto Agnihi. Medasaha Kshayaha, like the fat is all cleared off. You would not be like an egg, you would have the form that is desired to be. And Vibhakta Ghana Gatratvam, it means like the body is well framed and well formed. Every muscle you would be able to identify, the biceps, the pectoralis, and all that. You would be able to identify them. So it is vibhakta ghanagatratvam. See, when these things have to be seen, then one has to do very proper exercising only. I'm just quoting from the text of Ayurveda. It means that exercises are very essential. But in the meantime, you should not be overdoing this. Abuse is also very detrimental to health. For example, if a person overdoes, like overruns, probably we have been seeing in our daily practice that at the later age, they are coming with the knee joint arthritis, which is not welcome. Anyway, so abuse, you should know how much is abuse and how much is okay. And based on your profession too, it is not every person should be a macho guy, one need not. Depending on if it is a highly intellectual guy, he need not have to build a muscle. He should build his intellect. Depending on the job that he is doing, exercise has to be, framed accordingly.
Preeti has a question, and she says, if our good health is due to ancestors' good food habits, how do you reconcile the fact that there are so many people with diabetes and heart disease and hypertension? It's become an epidemic among Indians. And so how do you reconcile this fact?
The qualities that we have got from our ancestors is only one part of the whole scene. What we need to acquire, as Dr. Dayananda told in his talk, there is one sahaja immunity from the birth, and there is some kalakrita immunity. Like as you grow, you get immune to various things, and there are certain immune things that you take medicine and improve your immune systems too.
The rasayana.
Correct. There are other factors like, if you are maintaining a good, dietary regime, then probably you will not. And if you are doing a good exercising and good diet, which is expected to be, and then the lifestyle, which is like, stress free, because now with the stress, we are bringing a lot of newer lifestyle disorders. Thinking of hypertension, maybe diabetes, maybe metabolic disorders, and even say we call it depression, is also a lifestyle disorder. Most of these disorders are because of the lifestyle. And if we need to make it From our ancestors, we have got one good property, and now we have to improve upon them and try to maintain with what we need to do, and that is our responsibility to be healthy.
Okay. Girish Bala Subramaniam from Lucknow has a question. How do the mantras work on pathogens? Is what he wants to know.
Krimi Samhara, Sutra, Sukta, whatever has been told in Atharva Shastra has to be followed. And we have uh, Rashtra Raksha mantra, where we have to say that the Rashtra, or the universe should be healthy. We have universal prayers that has to be done. They do have their positive vibrations, and there is no doubt in it at all. Sometimes they can be validated. Sometimes we may not be able to have the tools to validate them. Still, probably we may lack them, but probably we have to do that. Daiva Vyapashaya Chikitsa have to be employed along with the routine Yukti Vyapashaya, or the medication and whatever the conventional treatments are. Along with that, Homa, as Dr. Prasanna Venkatesh told, Dhanvantari Homa or Mrutyunjaya Homa, are similar such sacrifices or procedures that has to be taken up, and probably that help a lot.
Okay, great. Dharma has a question and she asks, why does Ayurveda system sound like an absolute faith-based tradition rather than like science with data and evidence?
This is a misconception. I would like to say Ayurveda is a holistic science by itself. Science is one which has brought the relationship between the cause and the effect and the repeatability. I would like to make it very clear. Every disease, when we think of disease, has a cause, and that leads to a disease. And then every disease has a therapy or a management protocol. And this is very unique to every particular disease. And with a person, we identify them, and so scientifically it has been organized and framed. So it is evidence based for the same purpose, and the repeatability. And see, I do the same treatment, or probably other doctor who does the treatment, my ancestor who was giving the same treatment have got the same results. And that's why it has sustained 4,000 years of the generations and life. So it means that it is evidence based, it is with data, and it is only that we need to just put them into the right place to present it to the world. It is not that it is not without data. We need to only present it the way, the language in which they require, and that is what is being happening in all the research institute in and around India.
Okay, great. I also think there is an intersection between Jyotisha, Ayurveda, and yoga, which hasn't been explored fully. And it's sort of, again, a holistic way of treating somebody. And what do you think can be done in that area?
Correct. Ayurveda believes it in the Upanishad shloka, Ano Vadraha Tatavo Yantu Sarvasaha. From all angles, you need to bring in every good knowledge to support, and then that's how you make it a holistic science. Say, Ayurveda has taken materials from Yoga Shastra. It has taken from Sankhya Shastra. It has, we have, six, darshanas, Shad darshanas. From Shad darshanas, we have incorporated various materials to make it a science by itself. And likewise, now we are taking a lot of informations from the Western medical science to make it more aggressive, to make it reach the people. So we have taken the investigation procedures, we have taken the microscope, and then we are trying to understand very, very minute objects and trying to understand the Ayurveda way, so that we are again making the same principles work in this way. So, for example, we are trying to understand every alkaloid present in every herb, and trying to understand their properties separately and collectively. That's how we can put it forward. So, all this is being done. So, it is not a faith medicine at all. Faith medicine is something like a traditional thing. It is not tradition, it is science. I would like to make it very clear.
On that note, thank you so much, Dr. Anil Kumar Dixit. It was a pleasure to talk with you today. So, namaste. And good luck with
Most
all
welcome,
your
madam.
patients and treating them successfully with Ayurveda.
Thank you very, very much, ma'am, for the opportunity given and for everything.
Namaste.
Namaste.
Thank you for watching. You can subscribe here and also hit the bell icon to make sure you get notified. To donate, please click this button.